using the clinical data and samples that we have collected through the Women's Health Tissue Repository, we've been able to find new biomarkers that predict a hypertensive disease like preeclampsia, which you often don't diagnose until the last part of pregnancy, but we can predict it as early as 6 weeks of gestation. Nationally, we've been able to participate in a lot of huge studies. One notable one is one where we donated samples and clinical data and published a large paper in Nature showing a very early marker that can not only predict preeclampsia, but also distinguish gestational age by just your molecular signature. And then we also work internationally with a lot of folks in order to understand the mechanisms of the different types of pregnancy-related diseases.
Well, one of the important things about the Women's Health Tissue Repository here is that we include a lot of rural populations that are left out of research in other areas. And so women in rural areas have unique exposures, have unique challenges, and so to be left out of research does them an incredible disservice. And so this gives them an opportunity to be included in science studies.
What's important about this new marker is that we are able to predict and tell someone that they're going to have preeclampsia very early on in pregnancy. And when you have a disease that affects rural populations as well, being able to shift these people to areas where the diagnosis is more readily made and it's easier, and to get to a person to the appropriate care is an important thing for rural populations. So we think this is going to be an important tool